Good afternoon, everyone. Welcome to today's webinar, brought to you by the University of Illinois Extension and Rural Partners, which is Illinois' Rural Development Council. My name is Laura Hepkessel. I am with the SIU School of Medicine, and I'm also currently serving as the chair of the Rural Partners Board. There are a few housekeeping details I would like to share with you before we get started. Because we have so many on the line, please mute your mic and stop your video. If you have questions or comments, please include those in the chat space, and we will get back to those at the end of the presentations. If you're having audio difficulty, post those questions in the chat space and someone will be able to help provide some technical assistance. The webinar is being recorded and will be available later on the University of Illinois Extension website. You will get an email when that recording is ready to be viewed. So I would like to, again, thank you for being here. This is the second in a three-part series about telehealth. Again, that's being offered with University of Illinois Extension and Rural Partners. I have two presenters today that I'm very thankful they agreed to join us. We have Nancy Kazak, who has joined us. Nancy is the director of the Illinois Telehealth Initiative of the Partnership for Connected Illinois, which is an Illinois 501c3 nonprofit corporation. The goal of that organization is aimed at advancing telehealth in Illinois, the broader Midwest, and the nation. The initiative is the organizer of the Telehealth Law and Policy Forum, an annual multi-event series examining the telehealth landscape across the country. It is currently organizing multiple virtual forums on efforts to use telehealth during the COVID-19 pandemic. The Illinois Telehealth Initiative of the Partnership for Connected Illinois is also the organizer of multi-stakeholder telehealth demonstration projects. It has created the Digital Health Data Initiative to collect data on the effectiveness of telehealth during the COVID-19 pandemic. As a lawyer and former state legislator, Nancy is able to draw upon her background to operate effectively in a challenging healthcare environment. She helped lead the gubernatorial telehealth task force for the last 3 administrations. Thank you so much, Nancy, for joining us.
Great. Thank you. I appreciate the opportunity. Thank you for your kind words. This is a very exciting topic to talk about, and I'm really very honored to have be able to speak to the rural partners. I just want to alert people there's some construction going on next door, so there may be some noise. I apologize for that. As Laura mentioned, and Laura's on our board. She's one of the great people that's helping to guide this effort, both here and at SIU School of Medicine. As Laura mentioned, I am a lawyer, and I actually was a local government lawyer, used to be general attorney at the Chicago Park District, and worked with a firm that represented a lot of municipal governments around the state. So I really want to, I can really relate to who you are and the kinds of issues that you're facing. And so I really appreciate the opportunity to talk with you. I was a state representative for 4 years. And I sort of fell into this telehealth space about 10 years ago. The University of Illinois Institute of Government and Public Affairs asked me to look into areas where the university could become more of a leader. And one of the things they asked me to look into was telehealth. And of course, my first reaction is, tele what? I really had no idea what it was. So let me begin and tell you my journey and how I discovered telehealth and what its opportunities are. Telehealth is basically a way of connecting providers and patients using telecommunications. Currently, it's on somebody's phone. It could, I'm sorry, I didn't mean to zap ahead there. It could be on your phone. It could be on your computer. There's various other mechanisms or equipment that can be used to connect providers and patients, monitoring devices, a variety of things. What sort of blew me away about telehealth is that this is a way to dramatically increase access to care. Many times it's an opportunity for improving the quality of care, and potentially even it can reduce some of the costs of care. So this, to me, is a win-win-win situation, and that I really was very committed to explore for the last 10 years. So let me tell you what Illinois has been like between when I first got into it in 2010 and 2018. There was little telehealth going on in the state of Illinois. The University of Illinois Chicago was doing telehealth in the prison system for prisoners who are HIV or Hep C positive. There was behavioral health care going on in North Central Behavioral Health Services in Central Illinois was doing telepsychiatry, and Aunt Martha's used to be Youth and Services, but Health and Wellness was doing it in the southern suburbs in the Chicago Heights area of south of Chicago. The University of Chicago got some grant money, and they did a program, an ECHO program, where they would get their specialists to be able to be available to provide training for primary care physicians in their catchment area. But that was basically all that was really going on in Illinois. And there were burning platforms. Burning platforms were the rural and urban underserved communities. There are communities throughout the state that didn't have easy access to primary care and specialty care, both in rural areas and urban areas. Then the other burning platform was the opioid addiction, which has drastically affected the state of Illinois. And then the other area that I thought was a burning platform was behavioral health for students in the schools, because there's many kids that need behavioral health care and they're not able to get it. And the only way that many times that they can make that connection is through their school systems or their school-based clinics. So 2019 comes, and the Pritzker administration, I tell people it's like I feel like I went to bed in the dark ages and woke up in the Renaissance in March of 2020. But certainly in 2019, the Pritzker administration started the process of opening the door to telehealth. There was a commitment of $420 million for broadband expansion, which Matt Schmidt, who follows me, will tell you about. And that was just a huge possibility, opens huge possibilities. But in March of 2020, what happened is the Governor Pritzker issued a legal and regulatory changes that opened the door for telehealth, required payment parity. It required that insurance companies must cover and reimburse for telehealth services. Prior to that, Illinois was not hostile to telehealth. It just had a bunch of confusing regulations. As I mentioned to somebody earlier today, it was sort of like a ransom note. Everybody would pass issue a regulation, and you put it in the laws and in the regulations, but nobody figured out how they all work together. There was no parity for commercial payers, and there was no requirement for remote patient coverage for remote patient monitoring. But then, as I was saying, in March of 2020, Governor Pritzker allowed people to be able to get telehealth in their homes. Prior to that time, it was not considered an appropriate place because it wasn't necessarily HIPAA compliant, and it wasn't necessarily HIPAA compliant platform like FaceTime wasn't considered to be HIPAA compliant. But it was important that people be able to stay in their homes if they don't need to be transported to a hospital for a positive COVID test result. So that way the hospitals can stay open to provide care for those who truly needed hospital care. The Pritzker executive order also included provisions that mental health needed to be covered on this, because that, of course, is a huge issue for folks who are dealing with COVID-19 positive test result. And it expanded platforms. So now you can use Skype and you can use your phones. And for many people in underserved communities, the phone is what their mechanism is. I mean, if you look at the statistics over the last year, people in underserved communities got their telehealth services through the phone. So Governor Pritzker was expanding, all the opportunities in Illinois, but also at the federal level, there were huge changes going on. CMS, which is the agency that covers Medicaid and Medicare regulations, expanded it to all locations, allowed out-of-state providers to provide services within a state. It expanded the devices that could be used, expanded the platforms. It allowed for remote patient monitoring, and it added various services that normally were not covered before. With the regulatory change also came an incredible amount of federal funding in terms of just coverage expansion, but then through 4 or 5 different agencies, the VA, the USDA, FCC, Health and Human Services. There was, I think I calculated between April and August of last year, $1.6 billion, $1.6 billion that was available for telehealth. And that drastically changed the environment for telehealth expansion. And then Governor Pritzker also had related to that, a virtual care program that allowed people to be monitored from their homes. They would get daily virtual visits from a healthcare provider. They would get wellness kits that would measure various things, their blood pressure and various other things that they would give feedback to the hospital on what their experience has been and what conditions they were having. And what the Governor Pritzker did was he partnered with various regional hospitals, including SIU School of Medicine and various other, about 2 other hospitals around the state, and to provide COVID screenings and virtual visits and remote patient monitoring. And they even set up a specialized mental health component to it, where you could text call for calm, and someone would get back to you within 24 hours to talk to you about what concerns, emotional concerns you were having about the COVID pandemic. And there were various folks that were hired as pandemic health workers that would reach out and provide people the kind of support that they needed. So the question is, what can telehealth do? Right now, has been so clear over the last 6 to 9 months, is there are huge health inequities in our healthcare system, and telehealth should not expand those or continue those disparities, but telehealth should be used as a way to narrow the health inequity. And that is by being able to provide specialist care and primary care to people who normally wouldn't get that kind of care, and easily be able to provide it to them in their homes and in their communities. Right now, Illinois has 1.1 million households without computers, but many of them have phones. And what we found during the pandemic, the phones were the key things. But maybe they don't have the phones. Maybe they can't afford the kind of support and connectivity that is needed for good telehealth communication. And that is obviously something that I'm sure the legislature will be exploring this year. But there's lots of opportunities. There's virtual visits, as we talked about before, and there's various devices that can record your condition and give that kind of feedback to your healthcare provider. There's new sites that should be considered. Right now, there's a lot of equipment that's been distributed to students for remote learning, and there's no reason that I can think of why some of those devices could not be used for telehealth services. The other possibility is using libraries, who are usually very, very well connected to the internet, using those locations as locations for connectivity to the for telehealth services. And it's even been suggested that healthcare systems might want to set up kiosks in certain communities with someone there equipped to be a telepresenter, to work with a patient on connecting with their physician. So telehealth is here to stay. You can't put this genie back in the bottle. More people want to get healthcare at home. I saw a statistic once on Medicare usage, for seniors using telehealth services. And they said before March, there was less than 1% of the seniors used telehealth services. By April, over 40% of seniors have used telehealth services. And in surveys that were done of telehealth, of those seniors who had telehealth services, 78% of them said that they would like to continue getting services that way. And there were two reasons. One is you didn't have to leave your home, number one. But number two, they really felt that they got the doctor's attention more because the doctor was looking at them, making eye contact instead of, flipping through papers and looking at a computer chart at their office. So they really felt that they were getting a greater attention there. There's all sorts of possibilities in terms of what telehealth can provide. There are many communities, many hospitals around the state and healthcare systems around the state that have telestroke networks. And if somebody calls in having stroke-like symptoms, an ambulance is sent to their home with a mechanism that can determine whether or not they're having a stroke, and then provide them with somebody there who can provide them with stroke relieving the blockage, mechanisms and medicines that can remove the blockage. So there's lots of possibilities that are available to us, and these are exciting times. So I got to tell you, I know I'm not the only person here who's a fan of Hamilton, but this was my favorite scene from Hamilton. And this is the scene where there was a discussion that went on in Act 2 between Jefferson, Madison, and Hamilton. And out of this dinner discussion, they determined the location of the Capitol in DC and adopted Hamilton's financial plan for operating the United States. And I'm convinced that this is the virtual room where it can happen. There's people like you in the communities that can make a difference for healthcare, can bring people together, can find a common ground, and can really open the door to a better healthcare future. And with that, I want to thank you so much. And I want to turn it over to Matt Schmidt, who's my colleague and buddy over last year, and who's running the broadband services for the state of Illinois. Matt?
Thanks, Nancy. I'm going to do a quick introduction of Matt since I didn't do that in the beginning. So Matt Schmidt is the Deputy Director for Broadband within the Illinois Department of Commerce and Economic Opportunity. Matt administers the state's Office of Broadband and Connect Illinois grant program. Prior to this role, Matt engaged public policy from various perspectives and wearing different hats. He was a state legislator, leading on such issues as infrastructure and economic competitiveness, as an academic researcher, published author, and university instructor, and as an independent consultant. In office, Matt led the push for broadband access through creation of Minnesota's Office of Broadband Development and related border-to-border broadband grant program. Throughout his career, Matt has enjoyed consulting, collaboration, and research primarily in the areas of technology deployment, infrastructure investment, and economic development. Integration of 21st century infrastructure is a primary focus of his work and his research. For the past decade, Matt has maintained active membership with the Transportation Research Board, a branch of the National Academy of Sciences. So again, Nancy, thank you for the first part of the presentation, and we'll ask Matt to continue on.
Well, thank you so much, Laura, and thank you, Nancy. And it's a pleasure to join everybody today. And Laura, sorry, I got to get you a shorter bio to use next time, so I apologize for that. But I just have to say, given my background, I did carry some legislation in the Minnesota legislature when I was there regarding telehealth expansion. And so I absolutely love this conversation regarding one particular use of broadband, obviously for telehealth. There's so many uses that are critical to our daily lives, but this is one where I really think that we are on the cusp of, as we can all appreciate, a new way of doing business and of expanding opportunity. And so wherever we can pair, I think, new uses or applications with our broadband grant program, we want to take advantage of that. And so with that said, I just want to give folks warning. If you've tuned into our webinars in the past regarding Connect Illinois, there's going to be some familiar material here. I'm going to try to make the connections directly to telehealth where we can, but I'd like to use the next 10, 15 minutes or so just to kind of provide a little bit of background for those of you who haven't heard about Connect Illinois in detail, so that we can have a rich conversation on the back end of our time together here today. And so I'll try to go through this quickly, and if I gloss over any points, feel free to raise questions and we can certainly come back to it on the back half of the hour. And so moving along here, I'd just like to take a quick moment and talk about, well, first of all, our program overview here. Talk a little bit about our Connect Illinois vision. We'll talk a little bit about mapping, the opportunities with that and some shortcomings. Also our programming, give you a little background on our Connect Illinois Infrastructure Grant Program and our in-work digital equity and inclusion programming that supports that infrastructure investment. And then we'll spend just a couple minutes talking about some federal funding opportunities that we think are really key to seizing this moment. And so, as I like to mention, for those of you who haven't heard us talk about broadband with Connect Illinois in the past, the three-legged stool here, our approach to thinking holistically about broadband, it's not simply about this historic infrastructure investment that Governor Pritzker and the General Assembly had the foresight to invest in back in 2019, but it's pairing that with everything else that will make this infrastructure investment optimally important for Illinois. And so, first of all, that first leg, access. Yes, making sure that we've got the infrastructure and the direct access to connectivity in every corner of the state, making sure that's reliable, affordable, fully available to homes, businesses, community anchor institutions in every corner of the state. Secondly, we want to do what we can at the Office of Broadband to promote adoption and digital literacy. Working with our Broadband Advisory Council and some researchers this fall, we put forward a broadband affordability study that we think is really important to getting a good handle on some barriers to adoption. And so that's the second leg of the stool, option, digital literacy. And that third leg, as we look at this, driving utilization or use. How are we able to leverage this historic investment in broadband infrastructure to achieve, optimal ends in economic development and expanded opportunity and innovation, well, in such areas as telehealth and remote learning, not to mention a whole cascade of others. And so telehealth, as we say, it's a critical element of what we're doing here with our Connect Illinois broadband investment. And so, as I always do, I like to point folks to our website because it's where we store our information. It's how we best communicate with the public, make it known to Illinoisans that there are opportunities for folks to take advantage of. I won't spend a lot of time talking about the website itself, but a couple of pieces that we'll be getting into here today. As you scroll down that right-hand vertical menu, mapping is an important part of the conversation about where broadband is and where it isn't. We'll also talk a little bit about federal broadband. And so there's a link directly to some slides regarding federal broadband. And then just a description of our programming, whether it's infrastructure or digital equity. You can find all of the information that I'm sharing with you here today on our website, in addition to the webinar content here itself. And so we mentioned a little bit about mapping. Right now, an emphasis on the fact that the mapping that we're using is far from perfect. If you look at the map that's available on our website, it's based upon FCC data that we're very fortunate to have, very thankful for it, but we just recognize that there's some shortcomings with, I guess, the timeliness of it, the granularity and the accuracy of it. And so we look at the mapping as the start of the conversation in terms of where broadband is and where it isn't. And so with this map, you can zoom in on those dark blue areas that represent service level of at least 100 megabits per second by download by 20 megabits per second upload. So the dark blue area is deemed to be relatively good service in Illinois, but you zoom in there and you'll recognize there are pockets of undeserved areas or underserved areas, even within those darkly blue shaded areas. The light blue areas are areas that we consider to be underserved, between that 100 by 20 threshold and the FCC's definition of broadband, essentially 25 megabits per second down, 3 megabits per second up. And so those light blue areas are what we consider underserved. And then the green that represents big swaths of Illinois, unserved areas where the service level, to our knowledge, falls below that basic threshold for basic broadband, 25 by 3. And so just to reiterate the mapping, we're really fortunate to have mapping, but this is far from perfect. And we view it as the start of a conversation about where broadband is and isn't. There's other ways to get a better sense as to barriers to adoption and other impediments that are keeping folks from accessing the internet on a reliable basis. And I should just mention, we are looking forward to having better mapping available to us in the coming weeks. It's been a year-long process, both through state procurement and also working with a private mapping vendor and working with our broadband providers around the state to create more accurate, more timely, more granular mapping. And so we can't wait to unveil that to Illinoisans in the coming weeks. But for the time being, this is our map. And again, the start of a conversation about where broadband is and is not. And I think the key point here is if you don't have access to at least basic broadband, you might not have access to telehealth. And so that's the key factor here. You've got to make investments in this access and the infrastructure. And so just taking a quick moment here to talk about what we do in the Office of Broadband. I spoke just a moment about the mapping and in reference to our infrastructure grant program, the Connect Illinois Broadband Grant Program at $400 million for matching grants. It is the country's largest matching grant program offered at the state level ever. And so we're looking to make the most of that historic investment. But we also want to make sure that we're rounding out the work that we do in broadband. Again, thinking about that three-legged stool. And so we're building off of that infrastructure investment by developing an increasingly robust digital equity programming. And that includes our digital Navigator program, our Illinois Connected Communities program, our Broadband Ready program that I'll speak of in more detail, and then also something that we're really proud of, our Connect Illinois Computer Equity Network. And so I'll take a brief moment to talk a little bit about each one of these, and we certainly can come back at the back end to get into details. But right now we have one round of our Connect Illinois Infrastructure Grant Program under our belts. $50 million was awarded last June. And we make those $50 million available in grants up to $5 million each. And I have to tell you, we had grants that were $50,000 on the one hand, and we had a few grants that were $5 million on the other hand. And so it is scalable to, I think, the ideas that we hear from our communities and our broadband providers and other eligible applicants. And the four categories that we are introducing for the second tranche of $50 million, for which we are accepting applications now through April 12th, those four categories include broadband access, focused on essentially that map connecting the unconnected, those areas of particularly light blue and green, where we don't have access at those thresholds of 25 by 3 or 100 by 20, those areas that are eligible for investment for broadband access, extending that basic connectivity. That's one category. But we also recognize in order to get the most out of this investment in broadband, we want to be able to make apples to apples comparisons by way of different kinds of applications for our program. And so we have three different categories that complement that broadband access category in addition to it. Broadband innovation is specifically focused on pairing connectivity expansion with introduction of uses such as telehealth, remote learning, or precision agriculture. And so if there was an application that wanted to demonstrate cutting edge approaches to telehealth, for instance, and we're expecting some here for round 2 of Connect Illinois, that broadband innovation category could be a good category for an applicant to check. We also have urban broadband, which is focused on metropolitan areas of at least 75,000 in population or greater, just so we're able to kind of, again, make that apples to apples comparison between more population dense areas versus population sparse areas when we're looking at expanding broadband access. And then the fourth category we have is broadband equity. And this is actually a new category for round 2 funding. And this is focused on those areas where the economics are really difficult, maybe extreme population sparsity in the most rural of rural areas, where it's just very difficult for a provider to get a return on investment, or perhaps areas where you have historically low adoption rates due to poverty or various socioeconomic factors. Again, where the business case or the economics might be prohibitive for private sector investment. And so we have those four categories. Again, that broadband innovation one, we see a great opportunity for broadband providers, communities, healthcare providers to come together and think innovatively about how to expand telehealth. And so again, April 12th deadline for round 2 funding. And here's just a quick map of the results from our round 1 funding. Again, this is a matching grant program. So what was announced last June for round one, $50 million in first round funding, leveraged $65 million in non-state match for a total investment of well over $100 million, resulting in over 26,000 new or improved connections, again, to homes, businesses, community anchor institutions around the state. And so I won't get into too much more detail here, but the point is we're trying to make investments around the state. And the key here is these are fully scalable investments that will provide service at least to 100 by 100 megabits per second. So upload, download speeds we value equally. And we want to make sure that the investments we're making in our infrastructure program will stand the test of time. That they're fully scalable to the bandwidth that we need for whatever application might be of use. And importantly, multiple applications at one time. So if you got kids doing remote learning and you want to be able to participate in telehealth, you can all do it simultaneously through the kind of investments that we're making. All right, now shifting over to our digital equity package, and I'll get through this relatively quickly here. And again, we can come back to it if we have questions. We've got a couple of programs here that we're really high on. Our Digital Navigator program. In a nutshell, the key to this program essentially is to build digital literacy skills across the state, recognizing that there are a lot of folks who need basic information to, like, questions such as, who is my internet service provider, or what are my options in my area? How do I participate in a low-cost broadband service plan, or enroll for a subsidized, coverage? And in addition to that, how do I use the internet, or how do I build my own digital literacy skills? You think of what a modern librarian has become for patrons visiting the library. If you're not looking for books, chances are you might be looking to use the internet. And that librarian is the point person for helping individual patrons build their digital literacy skills, how to use the internet, how to navigate online opportunities. And so we want to build out this network in partnership with communities and organizations so that we can create capacity for digital navigator skills. And so we have an application deadline. It's going to be rolling throughout the year here. We'll have several, but right now we'd like to inspire applications by March 15th before we announce an initial cohort of digital navigators. Our Illinois Connected Communities program is really geared towards building broadband planning and capacity at the local level by engaging a kind of a holistic cross-section of the community, whether it's local government, folks in healthcare, education, libraries, economic development, the business community, philanthropy. And the real key here is that participating connected communities will get up to 50 hours of free consultant facilitator time to help them think through their broadband visions and where they want to go on any leg of those three-legged stools: access, adoption, or utilization. And so there is some grant funding that's available either on the front end or the back end of this opportunity. And we're accepting applications here through March 8th for our second cohort of the Illinois Connected Communities program. And again, it's focused on building capacity, inspiring local planning around a community's broadband vision. In our Broadband Ready program, it's similar to that Connected Communities program, but we're looking at the broadband kind of reality of our regions throughout the state. We have 10 of them, and we want to engage higher education, healthcare, our K-12 system, our libraries, community economic development, developers, and local government, not to mention other stakeholders, in taking an assessment of where we are today on a number of different digital equity and adoption factors. So that READY stands for Regional Engagement for Adoption and Digital Equity. And we have 2 rounds planned for this year. Round one, our first cohort is getting to work here in the coming weeks. And we'll hope to have a second grant opportunity for remaining regions later on this year. In a nutshell, the idea here is to identify best practices that are replicable or scalable around broadband adoption or use, certainly with telehealth being one of them that we're able to promote around the state. And the idea is this will pair well with that broadband access mapping that we'll be making available in the coming weeks. And so finally, just real quickly, just want to recognize that there's been some great investment at the federal level regarding telehealth expansion. The CARES Act passed almost a year ago included a historic investment in telehealth, both through the FCC, through the VA, and also through the USDA, in addition to the Department of Health and Human Services. And so some great opportunities that were presented federally a year ago. The recently passed Appropriations Act, the Consolidated Appropriations Act, included over $2.3 trillion in overall investment. And there was an extension of CARES Act spending deadlines to make some of this work, I think, more doable, and also some investment in telehealth specific programming, because there was an oversubscription, more interest than there was funding for through the CARES Act. And so some of that was through the distance learning and telemedicine grant program operated by the USDA, Department of Agriculture, as well as the COVID-19 telehealth program administered through the Federal Communications Commission. And so finally, I'd just like to spend a quick moment talking about a couple of opportunities that were included in that Consolidated Appropriations Act. One, the Emergency Broadband Benefit Program, $3.2 billion to make broadband more affordable for qualified households throughout the country. And when you look at the barriers that folks experience for adopting broadband service and utilizing the internet to the fullest, access or the lack of infrastructure can be one. You just don't have the service in your area. But for a lot of folks, it's the fact that that service isn't affordable. And so this builds off of the Lifeline program. And instead of having a subsidy up to $10 per month for broadband service, that subsidy could actually be as high as $60 a month, $100 additionally available for computer or laptop or tablet purchase on the front end. And so this is a great opportunity for us here in Illinois to look at one aspect of the digital divide, how affordability or the lack of affordable options can hinder Illinoisans' adoption and utilization of the internet. And so we look to take full advantage of this Emergency Broadband Benefit Program, and we're expecting more details in the coming weeks from the Federal Communications Commission. But again, a one-time, $100 subsidy for purchase of equipment. And then it doesn't say it on here, but a $50 subsidy on top of an existing $10 Lifeline subsidy for month-to-month subscription services. This is kind of a pilot program, if you will. The funding is not ongoing, but we hope that we get the most out of this opportunity to make it an ongoing tool in our toolbox for broadband adoption. And then another piece that I wanted to mention, I think this is essentially my last slide, the Connecting Minority Communities pilot program administered through the National Telecommunications and Information Administration within the U.S. Department of Commerce. We're looking for more details on this in the coming weeks, but this is another great opportunity to drive broadband adoption and utilization in our minority communities throughout the state of Illinois. And so there's not a lot of details out there yet, but it's something that we are really looking forward to seizing and taking full advantage of. And so finally, there's another opportunity that we hope to see. The American Rescue Plan, as it's been referred, $1.9 trillion is the number that's currently moving in Washington. While details are still being worked out, we hope that between this additional investment and any additional focus on infrastructure at the federal level this year or next, that we are truly at a historic moment in terms of federal investment in what it takes to close the digital divide, both in terms of dollars and programming, resources, and just alignment on the policy front. And that kind of brings us back to the point that Nancy had made earlier. We're truly in uncharted waters here, just in terms of the opportunities we have to participate and expand telehealth offerings. And so we want to make the investments we can on the infrastructure and access side. We want to make sure that we're doing what we can to promote smart policy so that we come out of the pandemic and this period of trying new things for the better. And we can learn from this and scale it and make it more available to more Illinoisans as we move forward. And so with that said, thank you for your attention. I hope that there was some new information in here for folks.
Thank you so much, Matt. So we do have plenty of time for questions. So I would just ask participants to please include any questions that you might have in the chat box, so we can, while we have Nancy and Matt both on the line, we can ask those questions. I did want to go ahead. I provided website links in the chat box to both Partnership for Connected Illinois, as well as Matt's office with DCEO, the Illinois Office of Broadband, in case anyone wants to go to their websites and look at anything. While we're waiting on some questions to come in, Nancy, I wanted to ask you, are there any current plans or upcoming forums that you have in the works with PCI or the Illinois Telehealth Initiative that you'd like the attendees to be aware of?
Well, no, we're in the process of planning it, and we have a committee that is pulling together. Things are changing on a weekly basis, and we have a group that is looking into it, and we'll certainly be able to have a schedule sometime in the near future, which we can send out to folks.
Great. And Nancy, what's the best way for, if we have any attendees here today that are interested in future events that PCI offers, how can they keep up with the work of PCI or know when, future forums are being offered?
Well, we'd be happy to add you to our list. We have a website called at Broadband, Illinois. You can look it up, or actually what we could do, Laura, is I'll send you the link and then you could send it to the attendees.
I actually already just put it in the chat box so that they
Okay,
have it.
so what can I say? You're ahead of me. Thank you. As usual, you're ahead of me.
Perfect. So if you go to the website there, it looks like you can sign up and get on Nancy's email list.
Right.
Okay. All right, we do have a question. So what is the minimum effective level of connection speed for a telehealth session to be viable? Matt, maybe, I'm guessing.
Yeah, no, that's a great question. And it really depends upon, what's being utilized. If you have two-way video and you're live streaming this, I think what you'll see online and resources will tell you as low as, a couple megabits per second might be enough. But I think the key here is, as our homes are becoming increasingly connected and we have, other devices that are drawing down bandwidth, we have kids doing remote learning, if we're watching multimedia that's pulling off of that broadband connection, all of that kind of cuts into what's feeding your house. And so I don't want to put one hard and fast number on it, but like, I would just say this: if you're falling below that basic broadband definition of 25/3 service, you can't count on having reliable connectivity for these sorts of applications that are so essential to 21st century life. And so that's why, it's a low threshold in Illinois, but that's why we're focused on making sure that we've got that basic threshold to every home, business, community anchor institution around the state, and so that we can scale up off of that. And so hopefully that helps give folks a little bit of understanding of, what's needed to use these applications.
Thanks, Matt. Next question. Brick and mortar health facilities are a really important part of the economy in rural places. How do we work to ensure that telehealth complements rather than supplants brick and mortar healthcare?
Well, I'll just say from the infrastructure side, I think it's just so critically important that we have that connectivity, both at the anchor institutions, the clinics, the hospitals, our healthcare facilities, but also on the other end of that connection. It's got to be a two-way, investment here. And so we've seen so many of our anchor institutions get better connectivity over the past, decade. It doesn't mean they're all there. There's still work to be done on that front. But the next challenge in front of us is that last mile connection to again, every last home, business, and community anchor institution. If you don't have that connectivity, that's a limiting factor. And of course, policy is just as important on this front as well.
Nancy, you have anything to add there?
Yeah, the only thing I would add is, there will always be a need for face-to-face connections between providers and patients. That will always be there. And telehealth only seeks to enhance that, to reduce the need to wait in a doctor's office to see a doctor when you can just schedule an appointment online, to get the kind of test results and monitoring that a physician needs in order to evaluate a patient, rather than waiting in somebody's office or waiting for the people to come together in a building and a piece of paper being sent from one place to the other. So the whole idea is to make the face-to-face more efficient and more effective, and doesn't in any way seek to, there's some ways that it will never supplant the face-to-face care.
Thanks, Nancy. Matt, we have a question for you that's not exactly telehealth related, but I'll ask it real quick anyway. Do you have any grant suggestions to expand IT to facilitate remote county board meetings?
This is a great question. And I think I want to give a good answer here. And I think if the question is on an infrastructure basis, I think that we've got a couple of opportunities, for our grant program, for partnerships through our Connect Illinois grant program. If it's on the equipment side, I don't have a great answer there. And so I think I would encourage that individual, if you're really struggling for ideas here, shoot me an email and maybe we can follow up offline. I don't have a hard and fast, hey, this is your magic bullet, but I realize that, yeah, I mean, as we're scrambling to do more and more things remotely here, you got to have the equipment in place to be able to, to pull it off. And so, yeah, I don't have a good, kind of go-to resource off the top of my head here. But, if there is a local government building, for instance, that was included in a Connect Illinois grant application, certainly there's an opportunity for some equipment to be part of that investment and to help improve not only the connectivity, but also the tools that you need to pull off the sorts of uses that you envision.
I'll just throw this out there as a fellow county board member. There I don't know if this would qualify, but maybe one thing to look into would be the CURE funding that was allocated to the counties from the state. That might be something, since that county boards are having remote meetings due to COVID, that might be a eligible expense from that CURE funding. So just maybe something to look into. Okay, who initiates the request for telehealth? Are patients requesting it, or are offices and health providers encouraging this?
I can tell you that's changed. From what I've heard, it used to be that specialists would contact the CMS and ask that telehealth regulations be eased and reimbursements be increased. And now what they're saying is they're hearing from patients. And they're hearing from physicians. I mean, I have a cousin who's a physician, and she swore that she would never do telehealth. And then I think at the end of March or early April, she called me up and said, "We're up and running. We're doing it now for 2 days. It only took 2 days to set up." And it was their practices. People did not want to come into the office. And this is a way that physicians could maintain their practice. So it's not only patients, but it's also the providers, the general providers right now, practitioners, that are requesting the help.
Great. And is there a need to encourage broader health provider participation in telehealth? And any suggestions on how or what communities should do to make sure telehealth options are understood?
Well, I think there's always an important, it's important for physicians to hear from patients as to how they want to connect. And I know the physicians are hearing from it. My cousin tells me that she gets lots of feedback saying, "This is really wonderful. This is a great way, rather than coming into your office, this is a great way for us to communicate." So she's getting that kind of feedback, and to the extent to which she gets that feedback, she's definitely going to continue that practice.
Thanks, Nancy. Back to Deb Warning's question. Dwight Reynolds with USD Rural Development said that might be something that USD Rural Development could help with the IT for remote county board meetings. So maybe look into those options as well, Deb. Matt, are there any telehealth projects or case example, something that you were familiar with in Minnesota when you spent time there, that you think Illinois could learn from?
This is a great question, and you're gonna have to jog my memory here. I think the world has changed so much in the last year, and sorry, I mean, that's kind of trite. We all know this, but I look at innovation across the board as being such a level beyond where we were just a couple of years ago on the telehealth front and in other uses. And so, what we were fighting for in my previous life in Minnesota is kind of on par with some of the policy that's either been settled or we've made significant progress on, and that's that parity piece. That's the reimbursement side of things. Is a telehealth visit the same or comparable to an in-person visit? Of course, to Nancy's point, in some cases, you really should never replace that in-person visit. But where you're able to do applications remotely using telehealth, there's just such a cascade of benefits. And so I can't point to one example and say, look, this was just a great pioneering example that we haven't surpassed in the last year. I mean, just traveling around Illinois, before the pandemic, and certainly kind of staying in touch with folks over the last year, there's just some great work being done in innovating in this realm. And so I think that, it's always good to look elsewhere and identify best practices. But frankly, I think we've got some great ideas here. And I think the real challenge and opportunity moving forward is how this becomes increasingly mainstream and accepted as high quality healthcare, something that we want to see more of. And so I think it gets to that point about the supply and the demand. And I think raising awareness that this is a good choice for providers and for patients for so many reasons, and then making the investments where we need to make sure that there are no barriers to adoption. And so if I can think of a great example from beyond Illinois, I will. But the examples that come to mind, I have to tell you, we're kind of doing them in our backyard already here.
Great.
Laura, I can add to that. I learned from Minnesota 5 years ago. 5 years ago, we had the director of government affairs for the Mayo Clinic come and speak at one of our forums. And the questions we asked them is, there was a great law, in terms of reimbursement available in Minnesota. And we asked them, how did you do this? How did you get statewide support? And what they said is they did demonstration projects around the state. And when they can do demonstration projects around the state, you sort of developed a local constituency that then at an appropriate time would advise their representatives as to the important role that that demonstration project played in their communities. So I think that's a big lesson that I learned from Minnesota. And thank you, Minnesota. Thank you, Mayo Clinic. And thank you, Matt.
Thanks,
I wish I could take credit for that one, but I can't.
So there's plenty of concern about hypothetical cybersecurity. Have we seen any actual problems in telehealth regarding cybersecurity?
This is Nancy. I've not heard of anything. Matt, have you?
Yeah, I'm not. I want to be careful. I'm not the authoritative voice on security issues with telehealth. I think it's definitely something that we all have to take into account and be smart about how we're making connections. But it's an obvious concern, and it's one that's been built into a lot of the platforms that we're seeing in widespread use. And so I think, hey, we don't want to ignore that concern, but I think there certainly are technological solutions to addressing it.
Thanks, Matt. We are getting close to the hour. I was going to see if Mike might want to go ahead and put the poll question up before we start losing folks. You will have a poll to respond to, and we just like you to click on the appropriate response to the question there based on our conversation today. While we're doing that, I'm going to share a couple of other things with you while we're here. So again, this was the second in a two-part series of our telehealth webinar series with Extension and Rural Partners. Our final presentation in the series is scheduled for next Wednesday at noon, where you'll hear from faculty members at the Illinois Institute for Rural Affairs at Western Illinois University about the value of telehealth to rural economies. So that you can sign up for that webinar. There was also a webinar a couple of weeks ago, and both the webinar from a couple of weeks ago and this webinar are or will be available on the local government education website with an extension in a few days. Make sure you answer that poll question if you are still with us and haven't yet. That would be great. Are there any final thoughts, Nancy or Matt, that you have before we wrap up? Any takeaways you want to make sure they have?
I would just add that these are exciting times, and there's lots of opportunities. And I'd like everyone to keep their mind open to various possibilities, various partnerships with people around the state who are working on this. And these are an exciting time.
And I think for my part, I just wanted to emphasize the fact that this is something that we're incredibly interested in. And even though much of our work is focused on infrastructure investment and getting the most of our Connect Illinois broadband grant program, we see direct connections to the expansion of telehealth and remote learning and other uses of that broadband. And so whether it's new federal funding opportunities or other opportunities for state partnership, we're really interested in engaging our broadband providers, our healthcare providers, and communities and Illinoisans around the state. And so just don't hesitate to reach out to us. And you can see our kind of one-stop email at broadband@illinois.gov at the bottom of the screen. Don't hesitate to reach out. We want to hear from you and do everything that we can to seize this moment here to expand telehealth throughout the state.
Great. Thank you. So as we wrap up, just wanted to mention Rural Partners again. If you're not familiar, we are Illinois Rural Development Council. We are a membership organization with a volunteer board. We are offering a webinar series throughout the year. Telehealth was the focus here at the first couple months, but each month we'll have a different area to focus on, and we'll offer different webinars in partnership with Extension. So please be on the lookout for those. And also I wanted to mention that the Western Illinois University, Illinois Institute for Rural Affairs, Rural Community Economic Development Annual Conference is being held virtually this year. It's being held in just a couple of weeks. So there will be a presentation on telehealth, as well as a lot of other important topics related to rural community economic development. So I did include a link in the chat box there to the Institute's website in case you're interested in signing up. Since it's being held virtually, it's a little easier for folks to participate. And there's also a link to the Rural Partners website. As always, we appreciate this partnership with Extension and working with them. We hope that you enjoyed the presentation today. Feel free to share the link when the recording is available with anyone else you think might benefit from hearing about telehealth. And we really appreciate Nancy and Matt's time today and spending that time with us. So if there's not anything else, I think we will call it quits. Thank you all very much.
Thanks, Laura. Thanks, Nancy.